everyone, my name is Taylor Henry, and I have chosen to do my presentation on sickle cell anemia. Sickle cell anemia is a genetic blood disorder caused by abnormal hemoglobin S, which leads to rigid, sickle-shaped red blood cells. So here we have a great visual representation of what a normal red blood cell looks like compared to what a sickle red blood cell looks like. The shape of normal blood cells are designed that way to allow for easy flow through the blood vessels. The abnormal sickle red blood cells actually make easy flow through the vessels not possible. This leads to a great amount of complications for people who are dealing with sickle cell anemia, which I will go into further detail later in the presentation. So I want to talk about the history of sickle cell anemia. Sickle cell disease was initially discovered by Dr. James B. Herrick, who I have pictured to the right of the slide. He observed the characteristic sickle-shaped red blood cells in a young West Indian student in the early 1900s. Sickle cell disease was actually initially called Herrick syndrome, named after the doctor who discovered it, but it is now obviously called sickle cell disease, as we know. In the bottom left of the slide, I also included a photo of Dr. Herrick's discovery. The molecular mechanisms. So sickle cell anemia is caused by a mutation in the HBB gene, which provides instruction for making a part of hemoglobin, leading to the production of abnormal hemoglobin S, that causes red blood cells to become sickle-shaped. So who is affected by sickle cell anemia? So sickle cell anemia primarily affects African people of African descent, but it also can be found from people in Mediterranean countries, the Middle East, India, and other parts of the Caribbean and South America. So now let's talk about some symptoms and complications of sickle cell disease. So a big issue with sickle cell disease is that it causes the people dealing with it great amount of pain crisis. People will get sudden episodes of intense pain. They'll have pain in their chest, their abdomen, joints, bones, and this is all pain due to blocked blood flow. The patients can also deal with swelling in their hands and their feet pretty bad, and this is again caused by blocked blood circulation. Interesting enough, children can also have delayed growth and delayed puberty because of the anemia. Jaundice is also another side effect, and a lot of people dealing with sickle cell anemia will have a great amount of just fatigue, and it's because of the lack of healthy red blood cells circulating in their body. So here I've just included some pictures so we can see the hands are swelling very badly. Also jaundice, which is the yellowing of the eyes and the skin, knee pain, vision problems, and just a great amount of fatigue. And this is all again due to not getting enough healthy red blood cells circulating within their body. So how is sickle cell anemia diagnosed? So sickle cell anemia can be diagnosed from multiple different ways. Newborns are always screened now for sickle cell anemia. There's also hemoglobin electrophoresis, there's genetic testing, you have prenatal testing, and there's also physical examination. You can go in, tell the doctor your symptoms. They can do blood tests, of course, and we as lab techs can obviously see sickle cell anemia underneath the microscope. So how is somebody with sickle cell anemia treated? So a big thing for sickle cell patients is really medications. Like I mentioned earlier, these people who have sickle cell are in a lot of pain, and there's medications that will help relieve that pain. Obviously, it's not going to cure it, but it will help relieve. Also, there is blood transfusions, and these blood transfusions can really help patients dealing with sickle cell, because it's able to go ahead and give them, healthy red blood cells and just make up for that lack of healthy red blood cells that are circulating within them. Also, another option that is great, but it's not very common for people who have sickle cell anemia, unfortunately, the stem cell or bone marrow transplant. And this is because with that becomes needing a donor, and that can be a whole process. So unfortunately, a lot of people are not able to get the stem cell or the bone marrow transplant, but this can really help with just generating healthy red blood cells that are not sickle shaped. So what is the prognosis for somebody who has sickle cell disease? So in the past, people with sickle cell disease often died at a very young age. There was not the amount of research and care for these patients. So yeah, the lifespan was a lot shorter than it is today. But now, thanks to modern medicine and care, people are actually able to live to the age of 50 and beyond. With sickle cell disease, it's way more manageable now than it was before. And the reason why people would pass away from sickle cell disease was because of organ failure and infection. So I wanted to add some interesting facts about sickle cell. So sickle cell disease is actually the most common genetic blood disorder. Another interesting fact, 1 in every 365 Black newborns are diagnosed with sickle cell disease at birth. And as you can see, that's a pretty large amount of Black newborns who are diagnosed with this. Gene therapy studies for sickle cell disease are definitely underway. Just in the past year, they've made great developments with sickle cell, but of course, these developments are not yet available for everyone who has sickle cell disease. Sickle cell disease also has various different types. So the type someone has depends on the number and type of gene mutations that they inherit. So the most common are HBSS, HBSC, HBS beta, thalassemia, HBSD, HBSE, and HBSO. So I wanted to add this video at the end of my presentation. I found this video very interesting. It really gives you a good understanding of the new technology that is available for patients when it comes to dealing with sickle cell anemia, this young man right here, he was actually one of the first to ever get his genes edited, which was pretty awesome. He was suffering with sickle cell anemia. He had very bad symptoms, and he was able to go ahead and get his genes edited, which was an awesome thing. And now he has no symptoms of sickle cell anemia, and he's doing very healthy now. Thank you.